boobs, and how do I find the right size? Here we go. This is a hot topic. Everybody wants to know about breast implants. You know, this is what I do every day. So I can kind of guide you and kind of give you an idea of what you're going to be kind of facing when you start making this decision about breast augmentation. But this is a really, really great surgery. It gives you a lot more confidence. A lot of my patients say they're more confident. They feel better how they look and feel better in clothes or bikinis. Get a little bit more femininity back. But it's really a decision that you make, and I'm here to help you make a better decision, educated, and get, that way you kind of get to know what you get into. Now, the first thing I want you to consider when you get in breast augmentation is go find some friends. Ask them, what was their experience? What have you done different? And then maybe they'll kind of give you an idea of what to kind of expect before you go visit a surgeon. The next thing you're gonna do is you're gonna go on the internet and read great information about breast augmentation from either plastic surgeons or our society websites. And so the idea is I want you educated to kind of have an idea before you come and visit with the surgeon, that you kind of have the big picture idea of what you're getting into. But what's gonna happen is when you visit a surgeon, they're gonna have some big questions for you. So what bra size do you normally wear, right? What bra size do you wanna be afterwards? And that's a great point of discussion I wanna touch on, is that bra size is completely arbitrary. Every vendor of different bra makers make different sizes and styles, and you'll be a D cup in one bra, you'll be a B cup in another bra, you go to different styles, and they're all over the place. And I'm telling you, it's gonna be even worse after breast augmentation because everything changes in how you fit into bras. So, just cup size, that's the first good question, is like, what cup size I wanna be? I wanna be a D, and I'm an A. That is not that far of a difference, to be honest with you, when you have an augmentation, because these implants come in different profiles and it has a different fill space in a bra. So again, it just kind of depends on you. The next thing you're gonna do is you're gonna talk about the implant types. And implant types, we have saline and silicone. And here's a silicone implant. And these implants we call the 5th generation gels. And these implants are basically so well engineered that these are extremely durable, very soft. They're designed for kind of a shape, the kind of look that you want. They're designed for safety. Probably one of the most heavily studied implant in the human body, hands down by far. So a silicone product, what it's gonna be, it's gonna be a silicone bag, and the inside is a gel. And that's what makes it special, because the gel is gonna give you some form, it's gonna give you shape. The rippling on the sides of the implant are dramatically less if you choose the alternative version, which is called a saline implant. And the saline implant is the same bag, but inside's water. It's just saline water. There's no structure to it, it's just water. And so the implant loses a little bit of the shape characteristics that you get an advantage with the silicone product. So in my hands, and I would say across the United States, the most common product that we use for breast augmentation is actually a silicone breast implant. So when you visit your surgeon, you'll probably get to see one, you get to feel one. Again, in the United States, we typically use a smooth implant, which is the implant's smooth, okay? You can see it's smooth. And it's a gel form and it's round, okay? And so what you need to understand with these implants is that when these implants go into the body, they're gonna be placed typically behind the muscle, the chest muscle, and behind the breast tissue. And under gravity, what happens, you get more fullness on the bottom than the top. So it has this more of a natural appearance. Women who want a little bit of the look, that's the next thing I wanna focus on. What do I wanna look like? Do I wanna look very natural? Do I wanna look like, my friends and family might not even notice? Do I want to look something a little more obvious, maybe that I'm wearing like a push-up bra all the time? Do I want to look more of like, people are very, very obviously noting that I have breast implants. And it depends on your desires and what you are looking into a breast augmentation, but it's your decision. And it's something we'll talk about when you visit with me. And so if you want to have a very augmented look, you get an implant, typically a higher profile implant. So the implant at the top of the breast is going to be a little fuller, and you kind of get more of that kind of upper pole fullness, which is a very common request for women. They want to have that push-up bra kind of look, but it's a spectrum. The next thing I want to focus on when you're considering this is you need to understand that you are built different than everybody else. Everyone has a unique body. Everyone has different breast shapes. Everyone has different tissue. You've had 3 or 4 kids versus not having kids. Your breasts will change during pregnancies. Your breasts will change during weight loss or weight gain. You might have a large side, you might have a small side. You might have a kind of a droopy side, you might have a kind of perky side. It's really up to you, and it's your anatomy. So breast augmentation typically enhances a lot of the asymmetries. If you have a lot of them, it can make them very, very asymmetric. And that's where plastic surgery comes in. And there are some things that we can do to improve the symmetry. So, but typically, standardly, breast augmentation is pretty straightforward. Most women are somewhat symmetrical in both their shape and their volume. And the augmentation is designed to kind of give you more fullness. And so, with your surgeon, you should definitely kind of be prepared to have a discussion of realistic expectations. And when I tell you about realistic expectations, you can't expect to have a look that is very voluptuous and very full, and then get a small implant that's going to go up like maybe not even a cup size. It's never going to happen. It's just not the same. And so that leads me to my last kind of topic, is that what is the biggest complaint of breast augmentation? The biggest complaint, and you're going to hear it from your friends, is that I would have wished I had gone bigger. So with that said, in my hands, I would say at least probably like 1 in 10 women, after I've told them this same discussion, at 6 months from surgery, when everything's kind of relaxed and they gotten used to having breast augmentation, will say, Dr. Morales, I know you told me this, and you were right. I wish I had gone a little bit bigger. I hope you learned something, and thank you for following. Don't forget to subscribe to my channel. Give me a comment below. Give me a thumbs up, please. Even if you don't use me as your surgeon, please use my website as a great source of information and to find the right surgery for you.